Welcome, everyone. Today we're diving into the details of Sucralfate, um, a medication primarily used to treat and prevent duodenal ulcers. It works kind of uniquely by sticking to ulcerated tissue.
Yep. So it's like a band-aid for your stomach lining, right?
Exactly. It acts as a protective barrier. It clings to the ulcer, shielding it from acid and enzymes to allow healing. Hmm. Quite fascinating.
And is it only for active ulcers, or does it also work as a preventative measure?
Oh, it definitely does both. It's used for active treatment, but also to prevent ulcers from recurring after they've healed. The approach is kinda holistic, you know?
Right. That sounds pretty useful. How is it typically administered?
Well, sucralfate is available as both tablets and a liquid formulation, and it's really important that it's taken on an empty stomach. So, usually, you take it 1 hour before or 2 hours after meals. This timing helps it properly coat the affected area.
Got it. 4 times a day for active ulcers and twice daily for prevention, I believe. That must require some serious discipline, right?
Absolutely. It's essential to stick to the schedule exactly as prescribed for it to work effectively. It might sound like a lot, but consistency is key.
Yeah. Now, what about potential side effects? I read something about constipation being a common one.
You're right. Constipation is one of the frequently reported side effects, but there's also a list of more serious reactions to look out for, like hives, rash, itching, difficulty breathing, and even swelling of the face or throat. If any of these occur, it's crucial to contact a doctor immediately.
Indeed. Oh, yes. I suppose the risk-benefit balance has to be carefully managed then.
Absolutely. Every medication comes with its own risk profile, and it's no different here. Doctors tend to monitor patients closely, especially when they're on multiple medications.
Speaking of multiple medications, what about interactions? I imagine sucralfate might not get along with everything on your medicine list.
Oh, correct. That's a big deal. For instance, if you're taking antacids, you need to separate them by at least 30 minutes before or after sucralfate. And even some over-the-counter drugs like cimetidine or ranitidine can interact with it.
Right. Now, that's interesting because it means patients have to really coordinate their schedules. I wonder how many might get the timing mixed up.
That's a very valid concern. Medication adherence can be tricky, especially when timing is so critical. It's definitely something physicians emphasize with clear instructions.
Yep, absolutely. What happens if a dose is forgotten? Does the guidance suggest doubling up later?
Not at all. It's important to take the missed dose as soon as you remember. But if it's nearly time for your next dose, you just skip it. And critically, never double up to catch up.
That cautious approach makes sense. I see. And what about storage and disposal? Is there any guidance on that?
Yes, definite guidance here. Sucralfate should be stored in its original container, tightly closed, at room temperature, away from heat and moisture. And the liquid version should never be frozen. Disposal is also important. Unneeded medication should be disposed of safely via a take-back program instead of, say, flushing it down the toilet.
Absolutely necessary. Right on. Safety first, as always. How about use in special populations, like pregnant or breastfeeding women?
Good point. Safeguarding specific populations is vital. Doctors advise that if you're pregnant, planning to become pregnant, or breastfeeding, you really need to let your healthcare provider know. Adjustments might be needed, or risks further considered.
Yes, very crucial. It seems like there's a lot of monitoring needed if you're on sucralfate, especially if you have underlying conditions like kidney disease or diabetes.
Definitely. If you're dealing with kidney disease, diabetes, or any gastrointestinal issues, and even if you're on something like enteral tube feedings, it's important that your doctor is completely aware. They might need to adjust other meds or doses.
Right. But, I want to challenge one thing here. If patients are required to follow these strict timings and monitor so many interactions, don't you think it might reduce compliance?
That's a fair observation, and it's something clinicians are aware of. The strict instructions can indeed be overwhelming for some patients. However, the benefit of protecting the ulcer from ongoing damage arguably outweighs the inconvenience. Plus, clear, thorough education can help mitigate that risk.
That makes sense. I also wonder how patients manage with taking something like sucralfate multiple times a day. It sounds like it could easily disrupt normal routines.
Absolutely. It's akin to maintaining a rigorous workout schedule. Your body needs that regularity to heal effectively. It might take some adjustment, but it's part of the
Yeah,
treatment
exactly.
commitment.
What about overdose? I recall there's specific advice provided if an overdose is suspected.
Right. In overdose situations, it's critical to contact the poison control helpline at 1-800-222-1222 immediately. Common overdose symptoms can include indigestion, nausea, vomiting, and abdominal pain. And if serious symptoms like seizures or trouble breathing occur, calling emergency services at 911 is a
Mm-hmm.
must.
Certainly, that protocol is pretty standard, but vital information for everyone to know.
Absolutely. Emergency protocols like these are the difference between a quick recovery and a complicated medical emergency. Keeping all appointments with your doctor and running necessary lab tests is also emphasized to ensure the treatment is effective and safe.
Right. It's clear that patient education is central here. Knowing what to do, when, and how with this medication is crucial.
Yeah, precisely. And that's why resources like Medline Plus provide so detailed information. They cover everything from the reason for its prescription to even the proper disposal of the medication, ensuring no stone is left unturned.
Absolutely essential. What about the actual mechanism? Does sucralfate interact with the stomach environment in any other interesting ways?
It's pretty interesting, actually. Sucralfate doesn't really neutralize acid. It rather creates a local protective layer. It's, like putting a temporary patch over a leak before you fix the pipe. That allows the underlying tissue to mend without constant exposure to damaging acids.
Yeah, that's a great analogy. I like that explanation. So, while it might seem a bit cumbersome with its multiple daily doses and interaction checks, the overall benefit is significant.
Exactly. It's all about balancing effective ulcer healing and prevention while managing the potential risks. And the comprehensive guidelines make sure patients and healthcare providers stay on top of everything, from dosing to side effects to storage and
Yep,
disposal.
definitely. This discussion really underscores the importance of detailed patient instructions and the need for attentive medical supervision when using medications like sucralfate.
For sure. And it's a great reminder that even a seemingly simple medication involves an intricate dance of proper timing, monitoring interactions, and, ensuring safety throughout the process.
For sure. Thanks for breaking it down in such an engaging way. It definitely gives me a clearer picture of how sucralfate works and the critical precautions that come with it.
Glad to hear it. Staying informed is key when it comes to medications. There's always more nuance than meets the eye.
Exactly. All right, that's a wrap on our deep dive into sucralfate. Let's hope this encourages everyone on treatment to pay close attention to their schedules and discuss any concerns with their doctors.
Absolutely. And remember, proper medication management is part of the journey to better health. Thanks for tuning in and take care
Yeah,
out there.
take care.